Hi everyone, it's Sonny McDonald here, and I'm the CEO and founder of Leadership HQ and McDonald Inc. And I'm so excited today to have on the Leadership Lounge an incredible explorer, an anesthesiologist. I got it right. Okay, an expedition doctor. Oh my gosh, a member of the Royal Geographical Society, and he's also our keynote speaker at the Courage Conference with Christine Holgate and Paul Scarra. And his bio is amazing, but this is the first time I met Gareth, and all our conversations and communication, he has just shown the most incredible, his leadership, he's humble, he's kind, he's certainly very courageous. That's why we're having him speaking. But also, I just want to tell a little bit about his bio because I just think he just rocks. He's awesome. But Gareth has been a member of 3 polar expeditions and has travelled over 1,500 kilometres on foot through the polar regions. That must have been amazing. Can't wait to find out about that. In 2013 with Richard, who is also going to be on this incredible, the last first great expedition. So is Richard part of it? Yeah, Richard's part of it, isn't he? Yep. He tracked 600 kilometres from Resolute Bay in the Canadian Arctic across the sea ice into the magnetic North Pole. My gosh, the month-long expedition saw him battle extreme cold, huge polar storms, leads of open ocean, and the constant threat from polar bears. Wow. As an expedition doctor in 2016, he completed an unsupported crossing of the Greenland Ice Sheet, travelling 550 kilometres in 26 days. What makes you go and want to, what makes you go, I'm going to be really courageous, and Richard and I are going to do, we're going to go out and do all this? What drives you to do this?
Well, first of all, thanks, Sonia, for having me, and thanks for those kind words. Look, I think for Rich and I, so Rich being my teammate on the last Great First, our Antarctic expedition, we've been teammates for 10 years doing these expeditions, the magnetic North Poles in 2013. And both of us just really enjoy being in the polar landscape, the polar environment. Yes, it's harsh and unforgiving, but that's part of the challenge. But, putting yourself in those positions, the 5 minutes at the start and end of every day when you see a beautiful sunset or sunrise, or there's points of absolute exquisite beauty to the polar regions that you really cannot experience in any other way. And I think from a fundamental level, that's what drives us. We just really love being in those kinds of environments. And if in doing these expeditions, if we are able to achieve things that haven't been able to have been done before, and also to inspire people through what we do, and contribute to scientific goals, then I mean the whole package is what we're really about.
So in terms of obviously the courage to do what you're doing, and also the scientific goals as well, because I know National Geographic are really supporting you around, especially with the last Great First, around this kind of climate change as well, for you to collect data. Because I think Mark, who's the chair of the last Great First, was saying to me, is it 2/3 of the world's weather is dominated from the Antarctica? So you're going to be out there collecting data, which I think is going to be so critical for us. We're the leaders of this planet, and I don't know why we struggle so much with climate change and what's going on with our beautiful planet. So you're going to be out there really helping us with getting some more insights and data to help try and change the face of how we actually, as a planet, as leaders, actually lead this climate change. Yeah.
Yeah, look, Antarctica really acts as a barometer for the health of for the global health of the climate. Essentially, it's it's a tough and hardy place, but the environment, the ecosystem in Antarctica is incredibly fragile. So working with the Antarctic Science Foundation and the Australian Antarctic Division and their scientists, we've got a unique opportunity to essentially take climate data measurements for 110 days across a transect of Antarctica, so moving very slowly across the entire continent over the course of an entire summer season. That kind of data really isn't available and has never been done before. So we're really hoping that makes a significant contribution to our understanding of what's happening to our climate at the moment. Putting that together with a project, the Million Year Ice Core project, that's ongoing at the moment. An Australian project through the Antarctic Division and funded through the Antarctic Science Foundation. They're drilling down into the ice sheet 1 million years, and they're looking at what the weather was like, essentially. Because what happens is with the ice, tiny air bubbles get frozen into the ice, and it's like they're small time capsules. And so by looking at the air, we can see exactly the composition of the air 1 million years ago, compare that to today, and it gives us a real insight into our climate at the moment.
Well, have you done anything like that before in terms of getting data around those air pockets or?
No, I mean this will be the first time that we do something that makes a significant contribution to climate change data, and it's something that we feel very strongly about, and we're excited to be a part of it. We've taken physiology data before on our expeditions, being both Rich and I are doctors, but this will be the first time collecting climate data.
So I know you were supposed to go this year, and we were just talking offline that now you're going in October next year and 2022, which, I know that you're both disappointed you can't go this year, but looking on the brighter side of things, again, there's more time to really talk about the expedition, have more conversations, exposure, champion climate change, champion what you're wanting to achieve over those 110 days, and get more people supporting and sponsoring you, which we're really keen to help you with as well. But what sort of challenges do you foresee? In terms of the courage to go out and do this expedition, what are some of the challenges that you have faced or you anticipate that you could be facing on this expedition?
Look, I think that there's physical and mental challenges. We're doing a lot of work around both our physical and mental preparation, and we've been talking, and it's by a long way it's 80% mental, 20% physical. I think the hardest thing will be just day after day for 3.5 months, just getting out of the tent, putting yourself through, a whole day, a 10-hour day of dragging a really heavy sled through some of the harshest environments on the planet, and just keeping the rhythm going and doing that day after day after day. And also, a lot of the time will be on the polar plateau, which is just like a big flat white ocean. It's like being adrift in an ocean. So there's also that psychological element of being in a featureless plane, and there's different ways that different people cope with that sort of thing. From a physical perspective, look, I mean, each of us will have a 200-kilo sled, so everything that we need to survive for 3.5 months, so all our food and fuel and safety equipment, and from a physical perspective, just dragging that any kind of distance is difficult, let alone 2,500 kilometers. And the environment, the terrain will change as we go. We'll have to drag that sled from sea level to 3,000 meters to get onto the polar plateau. We're planning on exploring a glacier that's never been explored before. So essentially, to get from the Ross Ice Shelf, where we'll be starting at sea level, to the South Pole or the polar plateau, you have to go through the transantarctic mountains, and to do that, you take routes up glaciers, and they're just like big ramps that go through the mountains. And so the glacier that we're planning on traveling is about 100 kilometers long. So, and it's the most treacherous part of the expedition. So it's unexplored. There are crevasse fields. There are, that will be the single most difficult part of the expedition, psychologically and physically.
Wow, what an achievement around. And I bet, is that I can hear someone crying in the background. Is that your daughter or your son?
It's one of them. It could be either of them.
Oh, have you got both a daughter and a son?
Yeah.
Oh, yeah. Beautiful. How old are they?
My daughter's 4 and my son is 2. Yeah.
That's such a great age.
Yeah, look, they're wonderful. And, we've spent because we were in the UK last year for a year, pretty much as soon as the COVID pandemic happened, we arrived in the UK. And so we've been in lockdown for quite a long time. And so I think because we're in lockdown at the moment in Sydney, and we've kind of got into this really lovely family routine. We're just like everyone is. We're just getting through lockdown, and there are lots of positives to come out of it.
There is, I think, that just focusing on your family, and it's and also the fact. I mean, you're such a great role model. I think being a parent is the most courageous leadership role we can ever undertake, but also what you're doing is, not only inspiring so many of us, but also your beautiful children as well. So it's great to see that you're showing this courage for them. And that's why I'm so honoured to have you speak at our Courage conference. Have you thought about what you're going to be speaking about at the conference?
Look, I think that yes, I have, of course, and courage comes in so many different forms.
Yeah.
There's the quite obvious courage of being able to, step across a crevasse with a big heavy sled, and you don't really know if you're going to fall in or not. Through to, the doctors and nurses and the porters and the guys that work in the kitchens and everybody that are working in healthcare or essential roles at the moment, just turning up to work every day, putting themselves essentially in the firing line. It takes tremendous courage. And just over my time in the NHS, there's just countless times and countless people just going one step further for their colleagues and their patients, and so courage comes in many different forms, and you don't have to be a polar explorer to be courageous or to have courage. So look, I think the experiences of the last couple of years have really have taught me a lot, and hopefully I can share some of that in the conference.
And I think that's what I think would be really powerful, is that you're actually living and breathing it every day. And I just look at the frontline health and our medical leaders, our healthcare workers who are every day stepping up with such courage to take care of, the people in our countries, in Australia. And I think that the resilience, I don't know. I just think it's amazing what you're doing in the industry, like in terms of taking care of us during this pandemic. I mean, I don't know. I don't know how that courage and that bravery is just incredible. And so you must be, in terms of seeing that and feeling that, and obviously you're living and breathing this courage every day in the work that you're doing. So. Yeah, I mean, how are you finding it out there? I mean, now that, you're in lockdown in Sydney, and with the cases in Sydney, it must be just heartbreaking.
It's It is really, and it's coming from. I was so, having been in the UK for a year, I was so hopeful that we would return to Australia, and COVID would never really happen properly here as it did in so around the world. But it just seems like now that the case numbers are rising, and the hospitals are seeing more and more cases, and it we're in a really serious situation, and the lockdown puts people in such difficult circumstances, but it's really necessary. At least for this short time, to allow the health service the space and that they need to treat everyone that needs it.
Yeah, I agree. Martin's just made a comment here, and I've just posted it up on the screen. I don't know if you can see it. In comparison to the world experience with COVID, US, UK, Italy, do you think Australia has been somewhat immune or shielded to the impact of COVID? Have we been a little bit naive or taken the view she'll be right, mate?
Look, I think so. I think that because COVID hasn't been so obvious here, the implications for people haven't been so prominent. Like in other countries, I can only really speak from the experience in the UK. It was very obvious that COVID was taking a huge toll. The daily figures, the daily death rates, and I do think that Australia has been shielded from that. And I speak to my patients at the moment, and there are a good number of them that really don't quite appreciate how significant COVID actually is, and the attitude that I should just get it and then it'll be fine. It'll just be like the flu. It's just like that's just not right. I'm afraid. You don't want to be one of that 30% of people that are genetically predisposed to getting the severe disease. And so the only real answer for us is for everyone to get vaccinated. It's the only way for us to get out of this place. And I was really hoping that the Australian approach to COVID would get us to a point where we could get everyone vaccinated before the community cases started to rise, but that clearly hasn't been the case. But
yeah, I think we just definitely need to get vaccinated because the toll on our healthcare workers, we just need to get vaccinated so we can start protect everyone and stop the lockdown and the border shuts and open the country up so we can, because the toll it's having on our mental health as well is just, it's really worrying. But in terms of your expedition, because I just look at even when I read Gareth's bio and the expeditions that he's done, I mean, in terms of how we can support you with this next expedition, okay? And I can see that the importance of this next one around this climate change and getting the data and now I know it's been pushed out for another 14 months. What can we do to support you? Like, what can we do? Like, I mean, I know definitely check out the website, and it's the last great first. Definitely check out the website. Martin's asked another question, but we'll come back to that one. Check out the website. But what else can we do around just obviously us doing something, even as small things around our own impact on climate change and what we're doing to support that as well. But what else can we do to support your expedition with Richard?
Well, look, please follow us and on our social media, on Instagram and Facebook, and on our website. We've got a huge number of exciting things coming up over the next year, various training expeditions, hopefully some time up in Svalbard, and then off to Antarctica in September next year. we're still looking for a title sponsor for the expedition. So any
So you're looking for a title sponsor. What does that look like? Tell me, so I want to see if I can help. Tell me, what does that look like?
Oh, look, so basically, all major expeditions have a title sponsor, and we would we are still, we would be very open to welcoming a title sponsor to take on the Last Great First. It's the reason it's called the Last Great First is, it's the last great polar journey in Antarctica. We called it that because Sir Ernest Shackleton was the first man to attempt to cross Antarctica 100 years ago, and in 2022 it will be the anniversary of his death. And he said the crossing of Antarctica is the last great polar journey. And so, look, we're going in his we're going to be stepping in his into his shoes, and hopefully we can be the first team to actually complete the journey unsupported. Just me and Rich on our skis. So
it's a great one of my favorites, the endurance. Yeah, the endurance.
Yeah, the endurance expedition. So look, it's a chance for a sponsor to be aligned with a historic event in not just polar history but human history as well.
Have you got anybody that could be listening that you would love to have that title?
Look, no, not really.
We'll have to put our thinking cap. So anyone that's watching, we need to support Richard and Gareth and this incredible expedition. And is there anything else we can do to support you? Other thanks. See, I'm not drinking out of a plastic, but I'm actually now, you've made me so much more cognizant of how I'm impacting the planet and what I can do to help climate change. But is there anything else that you think we can do to support you with your expedition other than follow you, support you? Yeah.
Oh, look, our key community partners are Scouts Australia and the Antarctic Science Foundation. So we're really excited to be working with the Scouts. It's such a tremendous organisation and a chance to inspire a generation of young leaders and adventurers to not just to go forward as good people, but also to take on that, the protection of Antarctica. If you can inspire young people and light a spark in them, then they will take on that baton into the future. And we're really hoping to do that with the Scouts and with Antarctica, because the excuse me. The frozen continent really sits at the center of the health of the global climate. So
I think that's why we're doing, like, for instance, the Leadership Awards and the Courage Conference, because we want to show our future generations hope, and we want to instill in them, when they see examples like you and Christine that's speaking, and the people that we have as finalists in our awards, that our youth and future generations are seeing you and watching you and listening to you and going, if Dr. Gareth Andrews is out there and he's out there doing that, I can do that and I can make a difference. And we need more role models, and that's why we're championing this, because we see so much negativity. I just think we see way too much negativity in our news feed on social media, and we need great stories. We need great examples, people that are making a difference and an impact. And that's why it's such the work that you're doing. I mean, I know that the Boy Scouts are part of this, but you're going to be your reach is going to be so much greater around giving people that courage and that hope that there's people like you and us out there that are trying to change the world.
Yeah, well, look, I mean, that's very kind of you to say, and likewise, everything that you're putting forward will have such a major impact in moving forward in a positive way. And with the Scouts as well, we'll have the opportunity for some of them to join us in Antarctica, not on the actual expedition, but they will be able to either fly in with us or meet us at the end. And again, it's just a great opportunity to to make them a part of the expedition.
That's incredible that you're doing that. I didn't know about that. That's amazing. That is really amazing. Well done.
It all lines up with hoping to inspire them and bring Antarctica into make it real for the future generations.
Thank you for that. Well, Martin has asked a question, so I just thought I'd better ask. He's just said as well, fantastic initiative and trip, wishing you lots of luck and success, which is great. He's also said, on the flip side, do you think that we've underplayed the adverse effects on people of the vaccine? What are your thoughts?
I think that the negative press and the negative attitude that the government have taken has impacted people's. It's impacted people's. The way that they've approached the vaccine, and people are reluctant to get certain vaccines because of certain things that they've been told by the government and by the media. And I think it's been very difficult to come back from that and to convince people that vaccine's safe. Vaccines are the single greatest advancement in modern medicine. For the last 200 years, they've saved countless millions of lives. The COVID vaccines are safe, they're effective. Everyone should get it as soon as they can. That's me on my soapbox.
Oh no, I think that's a wonderful soapbox to be and standing on that and saying that, because I agree. I just think that the sooner we all get vaccinated, unfortunately I agree. I think that the media, this is why I'm kind of like, our media sometimes has a bit, can be a bit frustrating around some of the things that they do kind of say and post and can really influence us. So I think that what I'm seeing now is on the flip side of that, which is wonderful, is that we're seeing so many people getting vaccinated and posting getting vaccinated. And, our only challenge that I found was trying to get vaccinated. Like, there were so many of us just wanted to get vaccinated. And I had my first jab a few weeks ago, and I was so excited. Like, I turned up and I do not like needles whatsoever. So I really love what you're doing, because I'm not a needles fan. I know there's people, I just literally just go. But I was actually really excited. Like, I just turned up and I went, bring it on. Like, I'm not a fan of needles, but I'm a fan of this one. So I just think the more that we can, and actually it was easy, the more that we can just get out there and get vaccinated and share that we're getting vaccinated, and the better. So I just, in terms of what you're doing for them in the medical world, in terms of what you're doing and your courage with this expedition, it's wonderful to see and talk to someone that is just such an amazing leader. So thank you so much. If anyone has got any more questions for Gareth, please jump on now if you'd love to ask him anything, because now's the time, because I'm about to close it off. But I'd love to know, is there anything that you would love to kind of talk about or say before we close off our live, which it's been such an honor to talk to you.
Look, it's been a real pleasure to talk to you too, Sonia. Thanks so much for your enthusiasm and support for our expedition. We're certainly very excited about it, and we need all the support we can get. And it's we would really like the Australian people to get behind us, because Rich is a Kiwi, and I'm an Australian, and it's an expedition for our country, so we're get behind us.
Well, I was born in New Zealand, but I'm an Australian now, so I'm very fond of Kiwis. So it's I think we need to get everyone in Australia and New Zealand supporting you. and advocating for you and sharing what you're doing. Just quickly, on your website, is there somewhere that we can also, like, if we want to donate or support, or is there somewhere on your website? I think I did see something. Is there somewhere where we can actually like support you? And
So you can donate to the expedition through our website. There's a place on the website to donate. And there's also a wish list, which is essentially you can get on there and you can buy us a meal. You can buy us one of our dehydrated meals, one of 400 that we'll be taking with us. You can buy some goggles or a pair of gloves or whatever. But also soon you'll be able to donate through our website to the scouts, and that will also come through to the expedition, and it'll have tax deductible status. So there's lots of ways to contribute to the expedition.
I love that. All right, well, I'm going to get off now. I'm actually going to do that right now. As soon as I get off our live, I'll be on there donating, or I'd love to buy some meals. What do you actually? I have to ask before. What do you eat? So, what do you actually eat for the 400 meals? Like, what does the 400 meals consist of?
So it's all dehydrated food in packets. So you have to boil up some water and just add water, and a combination. So we're using a company working with a company called Firepot in the UK, and they make great meals. And essentially, they just make big batches of spaghetti bolognese and chili, and they stick it in a special dehydrating oven. So, and when you rehydrate it, it's literally like having a homemade spaghetti bolognese. And when you're eating it for 3.5 months, that's exactly what you need, right? You need real food and real nutrients. So mostly porridge in the mornings, some kind of chili or a spag bol in the evenings, and then some snacks during the day. It's a bit more scientific than that, but general gist.
It sounds pretty amazing. So it's just so great. I'm going to I'll send me your address, because I'd love to send you my book, First Comes Courage, just to say thank you for being on my live today. And I'm really excited about seeing you speak at the Courage Conference. Even though you're in Sydney and we're in Brisbane, we are praying to the COVID gods that the borders open. I'm sure by the time the conference happens, we're going to be, is it 70 or 80% vaccinated that we have to be? I think I can't remember.
I think it's 70%.
70%. So, and then you'll be up in Brisbane with Mark, having it's going to be such a wonderful conference. We've already got so many people that have bought tickets, and also there's so many people around the globe, which is even more exciting, that have bought tickets live stream, because we're live streaming it around the globe as well. So and also Central Queensland University, which is, and again, you can talk to the Boy Scouts about this. Central Queensland University are one of our main sponsors. And I spoke to them, one of the key leaders, and we're going to give them a free link. And they're actually they've got campuses all around Australia. They're going to invite all the high school students and students into all their campuses and all their theatres and things. And they're all going to give all the children free live stream tickets, so they can all sit in these auditoriums for the day and watch the live stream. So we're going to be reaching out and touching the lives of so many children. So they're going to be getting to watch the conference for free for the day.
That's amazing. Really amazing. Well done.
I'm very excited about that.
I'm so excited to be a part of it. Thank you.
You've just been so wonderful to deal with, and anything we can do to support you and sponsor, donate, we'll be doing that. So well done, and thank you so much for being on the Leadership Lounge. And yes, it's been a real honour. So thank you.
Oh, thank you very much. It's a real pleasure to talk to you.
Okay, well, you take care and you stay safe.
Yeah, thanks, Sonia.
Take care. Bye. Bye.